Preston Parry. I'm a reproductive endocrinologist, so I get people pregnant for a living. Well, actually, the whole team. I always joke with people, it takes a village not only to raise a child, but to conceive one. And we've got really good group that get a lot of people finally on their path to being successful parents. So that's what we do. For my background, everyone wonders, how does a guy become an OB/GYN? My mom is a 33-year breast cancer survivor, actually 34 this October. And I've been on the other side of the equation. There was this vulnerability where we were scared, confused, worrying about things, whether mom will live or die. And I think there's a great appreciation you have for what it's like to be on the other side of the equation. And I just never wanted people to have that vulnerability that we had. And so if I can do anything to stack the deck in people's favor so they don't have to worry about how we did, that's wonderful. A great line I got once, people said, you know what? They want to know how much you care before they care how much you know. Now we're a smart group. We've got patents, innovation, groundbreaking stuff, international conferences we speak at, and our leaders. But at the same time, I think there's a great deal of empathy for us. If I hear this from patients all the time, they're like, look, I know we want it the most, but you guys care almost as much, if not as much as we do, about getting to the other side. And I think the fact that people are really rooting for you, it's not just a job, it's a calling, it's a passion, that we really want people to be successful and have that family of their dreams, that matters a lot. I'd say about 70 different things to new patients. This is why our new patient consults end up taking so long. We talk your ears off, and you'll see we'll spend 30, 45 minutes often doing an intake before we even get before you even get here, and then there's the 30, 45 minutes when you're actually here. But I think the most important thing, beyond the insight, again, Dr. Google will give you facts, it won't give you perspective, to say where people actually are, so that they know where they are, what we do about it, and where they should head. The other thing that people really should know is that they're not alone. There's hope, there's a lot that can be done. Don't put it on your own shoulders. Let us figure it out for you. I use this line all the time. I say to people, look, you can have all the fear of flying you want. What matters is if the pilot has a fear of flying. We'll figure this out. You don't need an aeronautics degree. Just get your ticket, get on the plane, just take your medication, show up. We'll take care of the rest for you. You don't have to figure it out. We do this all the time. And so many people get on the road that they want and are happy because of it. I hope we can do that for you or your friends or anyone who's needing that support on the TTC journey for being future parents.